Dr. Adam Rosh, you've been following this pandemic since, of course, it began and have been really talking about how it's affecting us. So let's get right into it. Where are we now in the Detroit area relative to this pandemic?
The numbers continue to rise, but there is good news, and we're starting to see a flattening, a plateauing of the numbers and the number of deaths, which is great, because what we have wanted to avoid from the very beginning is to be able to flatten the curve so that we reduce and limit the number of unnecessary deaths. And I think people have done the right thing, and we are seeing a plateauing. But that does not mean this is going to last like this long into the future.
Yeah, so is it safe to say that we're beginning to flatten the curve? And is staying at home, this whole stay-at-home shelter, is it working?
Right now, when we had a surge of cases, the very beginning of COVID-19, the most important thing was going to be physical distancing, staying at home, keeping out of crowds, good hygiene. And we need to do that to flatten the curve. And we're doing that right now. The next phase of this is going to be, how do we get back out and get the economy started again? Because we can't do this for 18 months. But COVID-19 is going to be a long-term problem. And so these are not mutually exclusive. Preventing spread and getting the economy started again need to be done together. There are things that we could be doing side by side in order to do this.
But Dr. Rosh, we know that things will never go back to exactly how they were before this pandemic started. You've said that before. What do you mean by that?
The fact that the virus that causes COVID-19 is endemic in our society means that we will always be at risk of being infected. And what's really important, though, is that when we are able to get back out, that we get as many people as possible who have proven immunity out there, because they're going to act like lightning rods, and they're going to limit the spread among everyone else.
Okay, so you say proven immunity. Who are these people exactly?
So right now, if you have tested positive for COVID-19, the next step for someone like that is to be able to get serological testing. Serological testing measures your antibody response to the virus. Now, just because you've been exposed to COVID-19 doesn't mean you're actually immune to COVID-19. And there's a lot more information coming out about this. But based on virology in general, we know that an exposure to a virus should lead to immunity. Now, in order for us to get back to some semblance of normality, we're going to need to find out who is able to mount a strong immune response and get those people out into the public. Because the more people that are out there that have been not just exposed, but who have mounted a strong immune response, they're going to dilute the spread. They're going to prevent the spread on another massive level. They act like lightning rods. And so we need to identify those people and get them out.
Dr. Adam Rosh, we thank you so much for your time today to get your perspective. We will talk to you again really soon.